Well, while we're waiting, I guess let's just take care of a couple of housekeeping items. We'll get that out of the way. So first off, my name is Matt Simmons, President of Syntech Solutions. Thank you for all taking the time today. I know sometimes these Zoom calls can be overly burdensome on the work you're trying to do, but we're trying to jam it full of information and make your lives easier, not harder. So, you know, if you don't recall, if you didn't see it, HUD put out some guidance related to conducting the point-in-time count in the midst of COVID, and we've been digesting that and reacting to it, helped inform actually some of that guidance. So we had a little bit of a preemptive ability to get things in position, but yeah, we wanted to share those with you today. So starting off with housekeeping items, I don't know if Becky, if you don't mind.
Sure. Hi, everyone. Thanks again for joining us. Becky O'Mara, Community Impact Advisor with Syntech Solutions. We're very glad to have you all on. You are all going to be muted for the presentation. If you have a comment or a question, you can use the chat feature, and the Syntech team will be keeping an eye on that. And we can also unmute you if you prefer to ask your question verbally. We are recording the webinar, and we will send it out to registered attendees following the session. If you didn't register or you'd like to share it with someone, you can just send us an email at team@syntechsolutions.com, and we'll be sure to get that information to you.
All right, excellent. Thank you very much. So what would the perfect point-in-time count look like? To everyone, it's a little bit different, but you know, you want to have ample planning time. It would be great to have lots of volunteers, outreach data, people going out there on a day-to-day basis to inform the known locations, to get to know people that are already living on the streets. Ideally, the work is automated, so you're not doing a lot of transcribing of paper, and everything is real time, you know, just beauteous. Coordination with law enforcement, you want to have your outreach workers all gelling, covering their areas, communicating with one another. That's the utopia that we're ideally working towards. And then we had the reality of COVID hit, so no longer the perfect world, so we have to work around that, right? So I just pulled this from the CDC in case you're curious of where your state stands, and even within state there's pockets, but this isn't, you know, infection rates lately, you know, we're data people, so we kind of lead with that. So obviously with COVID, we have heightened safety concerns. There's a potential decrease in the number of volunteers that we have to work with. You know, less volunteers means, you know, we have to get creative. Either, you know, do we put more work on the volunteers that we do have, or do we think about other strategies to conduct an effective count? And then even lack of internal staff capacity, you know, with childcare needs, sometimes there's one parent has to stay home and force that decision, and you know, there's those implications. Sometimes budgetary constraints are forcing nonprofits to have to make a tough call. There's different reasons. Some people that could be infected or don't want to have the risk. We have, you know, seen a lot of cases where, you know, family members are higher, you know, more vulnerable, and so therefore, you know, to have a frontline worker, it's riskier to have them come home to someone that's in an at-risk population. So you know, they might have to make a hard decision to no longer do the work of street outreach, or you know, working in shelters, et cetera. So that's our reality. So what HUD has done is they still, you know, value the point-in-time count, with something that's been going on. I've been doing it since around 2002 or 2003. So kind of tells you how old I am. The gray in the beard reflects that too. But you know, ideally, you're trying to build a trend analysis over time to see how you're doing. You know, are the decisions you're making policy-wise, the funding allocations you're doing, are they making a dent? You know, that way we can try to target resources more effectively. There's a multitude of reasons for doing it. So this year, what are we going to do? So you can file an exception allowance. So there's guidance, and we'll be sharing that. So basically saying, you know what, this is not the year for us. There's too many concerns for doing an unsheltered count. You know, you still have to do a sheltered count. So you know, you don't get out of everything. You still have homework, but you could file an exception allowance. You could do an observation only count. So we'll talk through about what that means. You could just do brief survey counts, so not having the same length of surveys as you did in the past. You could conduct counts over a longer period of time. So again, it's not a one-night initiative here. This is allowing you to do more or less. That's an option. You could do, and we'll be explaining these things too. So sampling and enumeration is an option. Utilizing HMIS or other unsheltered data sets. Ideally use mobile counting applications. So we're obviously a fan of that guidance. Provide remote point in time count training. So, not trying to bring people together for training, but doing it, similar to what we're doing right now with Zoom training, or Teams or whatever tool you use. And then volunteering, when you're doing your volunteer recruitment, to screen out those high risk participants. Not saying you don't want them to help out, but can you give them other ways that they can help out that don't put them at risk? So there's a multitude of factors to think about when you're deciding what approach works best for your community, and every community is different. And that's what we're trying to share here is, what do we have to work with, and then help you digest what's going to work best for your, COC. So do you have street outreach that are available and first responders to actively engage with people experiencing homelessness, gather their information? Do you have those trusted resources that you can lean on? Jenna Marie was on the call earlier starting things off, and for San Diego, she and her colleagues, we have that luxury to be able to lean a little bit heavier on them. Thank you, Jenna Marie. Not every community has that. So do you have your own army of Jenna Maries? Maybe not Jenna Marie, but other people. Sorry, not the guys. We're going to clone you. What's your availability for volunteers? Do you have a lot of volunteers? So if you do a recruitment campaign, are you seeing a negative reaction due to COVID, or is it just the opposite? So we've actually had some volunteer opportunities to help assist the people experiencing homelessness here in San Diego, and it's for meal distribution where we're providing meals to people. It's over 1,000 a day, and it's gotten to the point where there's so many volunteers. You're competing over lifting boxes, so it's because people want to help. So you might expect that the volunteers numbers are going to go down, but you might be surprised because people do still want to find a sense of purpose, get out of the house sometimes. That can be pretty nice, but also a chance to give back to people that are at high risk. And being homeless is tough enough, but being homeless during a pandemic, you have to have a heart for those people. So, but it may go down, so we have to factor that in. What are your current local conditions? What's the weather? What's the current infection rates? What's the general appetite? And risk tolerance. Everyone's different. And what do you have as far as your ability to protect the people experiencing homelessness and the volunteers that are going out there? So, do you have PPE? Do you have guidance? Are you able to, do this safely and effectively, maintaining social distancing, just like the same thing when you go to the grocery store, or wherever you go out in public, you need to be safe and thoughtful about how you go about doing it. And then the accuracy of the approach that you take, there are implications for each approach. And we'll talk those through. And so, obviously the ideal is to have a perfect count where you know everyone living on the streets, what's going on with them, their disabilities, their, any barriers to housing, whatever it might be. There are options, and some of them are going to get you closer to perfect, and some are going to kind of push you further away. So you have to kind of do a risk reward analysis on your own to figure out, what's our comfort, and where do we want to go with. And again, we'll talk through those options. So the exception allowance, that's option one. Let's start there. So advantages of it it's the most risk averse option. So, you know, to do nothing, you know, is also a risk too, right? So, you know, the risk aversion here is on health and safety. There might be other risks of not doing it that you have to weigh out. So just, again, every community is different about their risk tolerance and how they want to approach it. The disadvantages of filing an exception, you need to be able to justify the reasoning. You know, it's a national pandemic, so, you know, why is your community different, or, you know, stand out that you really need to file an exception compared to other communities. You will be missing out on data for local planning purposes that, you know, unless you have another source for it. So that's something to weigh into it. So here's the idea of another source. You must have another means to understand the needs of people experiencing homelessness. So you'll see that acronym a couple of times. I'm sorry for acronyms. I know we have enough of them in our space. So the other side of it is, by not going out there and asking people, you know, about their homeless situation. I mean, one of the things that we did after the hurricanes hit Texas is we quantified the extent of homelessness that came from people that were evacuees of the hurricane. So we could be doing the same thing with this COVID, you know, it's not a natural disaster, but a pandemic. And asking if someone's homelessness is a result of COVID, and how you tease that out might be different, but we have that ability to customize the questions and measure the impact of the pandemic on the homeless population. So one of the things that it's going to weigh into, you know, the decisions is what you have to work with the volunteers. So, you know, we can support the volunteer recruitment exercise. There are tools that, even like what you use today to register for this, Eventbrite is something that we use. There are pros and cons to each, but I'll kind of explain that. So however you do it, it's a good opportunity to screen for high-risk volunteers and provide some low-risk opportunities for those volunteers. So someone is, you know, 78 years old, has a chronic health condition, but wants to help, maybe you can give that person the job of coordinating the building of, you know, community care kits, for example. So they're not going out during the count, but their job is to maybe make phone calls to local business and say, hey, we need Kleenex, we need, you know, hand sanitizer, we need this. And, you know, if you can make those calls, that'd be great. We could, you know, the people in need really appreciate that. You know, so there's other ways that ideally you can incorporate, you know, their assistance. So the other option with the volunteer recruitment is to be able to provide the volunteers the ability to select the region within the COC that they want to volunteer in. It's not a big issue for small COCs, but some of the larger ones, Balance of State COCs, San Diego County, where we are, you know, the geography is just too large, and you know, some people might not be comfortable traveling to the other side to volunteer. So to give them first choice. So here, this is an example of a volunteer registration portal. I think this one's from Spokane. Thank you. We've got several others up on our website too. So, you know, if we do handle your volunteer recruitment, we'll help you market that too. What it is, it's a public-facing site where you can share key details of the account. So the idea of the purpose, like what are we trying to do, what to expect, and you can also use it to the form side of it. You can use it to gather key information about the people that are looking to volunteer. So, you know, the idea is to create well-balanced count teams, and ideally lean heavier on people that have experience in the field, especially this year more than ever. And if you already use the volunteer registration portal that we have as an option, it is directly integrated with the command center. So, you know, explain how that kind of comes in when it comes to creating teams in a second. So some COVID considerations. Literally, I mean, we have some, you know, again, we can, I think in our field, we call it legitimate larceny, but you can look at the volunteer registration portals created by others and borrow good ideas. I don't, if anyone is really opposed to that, let us know. But I'd be surprised. So, go look at the other portals that have already been created. What kind of content would you like in your own? Again, if you want to bring it over to Eventbrite or SurveyMonkey or something like that, you can do that too. But the idea is to try to get it out in front of people to say, we care about your safety. We care about the safety of people we're interviewing, and this is what we're doing about it. So, and you might want to include a disclaimer. That's optional too. Basically, there's a presumed risk that the volunteer will be assuming. And then to support the social media, the marketing side of it, what we've done is we've created some boilerplate images. I say we, thank you, Nikki. We're all we, but I didn't create these. So what Nikki has done is created some boilerplate images that you can use, and you can access them from our website, pointintime.info. And there's also a link. And again, when we share the slide deck around, you'll be able to see that. But one of the things that Nikki found is content with relevant images gets 94% more views than content without relevant images. So ideally, these are our starting point. And then what you end up doing is when you post it on social media, you include the links to your registration portal and maybe a little quick blurb about, the need. And ideally, these things, get shared in your COC board. People, pass them along, they retweet, what have you, and then you start building a base, and using social media to get your volunteers. And that's going to really dictate a lot about the approach. Once you start seeing the volunteer numbers come in, you'll have a better idea of what your options are. So try to get your volunteer recruitment going sooner than later if you think you're going to go ahead with a count. Observation only counts. So now we're talking about the options that are available. So as it might sound, it's, you're basically visually looking at someone, and you're quantifying their homeless experience. So advantage is it's very simple. You have your phone in front of you, you look at someone and say, I think they're homeless, capture some basic demographics, move on. So that's an advantage, is its simplicity. And it does enable you to get a baseline count of people experiencing homelessness. So that sounds good. Okay, so should we do that? And for some communities, that's the level of risk tolerance they have. They're just going to go to that level and be done with it. And that's fine. I mean, this is not an ordinary year. The disadvantages of the approach, just to see if you're aware of them, is you're presuming a person's housing status. Just by looking at someone, you're assuming, oh, this person must be homeless. Another disadvantage is you're also presuming their race, their age, their ethnicity, et cetera. So, gender, some things that really you should be asking people about instead of just assuming. And then you have the potential for double counting, because people can move around, and they do move around. So two volunteers see the same person, you're not gathering any information about that person. How do you, presume that someone else didn't already, record that person? So, there are some things you can do as far as planning to say, we're going to break out our canvassing, and you're covering this region, you're covering that region, and to work together. But it's just still, people still do move. So just something to be thinking about. And then, beyond that, you're not going to have any reporting for what can't be pulled in visually. So disabling conditions, veteran status, et cetera, those are out the window for this type of approach. And the other side of it is, if you have a limited number of volunteers, you're going to need to, for observation only counts, you're going to need to still conduct the point in time activity on a single night, unless you can, if your region is like, maybe there's a mountain range in between your regions, for example, and people just don't move between one side of the mountain and the other. If there's a lack of mobility in the region and you can really break it down, then you can make the argument that it's okay to do one side of the mountain on one day, and maybe Mondays, the west side, and Tuesdays, the east side, and that makes sense. But if you feel like there's mobility between regions, you don't really want to go that route, because Any questions in the chat, Nikki or Becky, that while we're at this so far?
I have one question about going into detail with the app, like how do you enter data? And I'll respond just that I'll put in some resources in the chat for those of you that are looking for more instructional videos, but I know that we'll get a bit more into the app and its features in just a moment.
Yep, absolutely, absolutely. So an observation tally, so this is actually one of the mechanisms to capture data in the Counting S app. And what this is it's 4 simple demographic questions in a notes field. So this is, the reaction to that, the last slide. So this is how you would be doing the data capture. And you're looking at things like age range, not exact age, perceived gender, perceived race, perceived ethnicity, and then notes about the person. So this is where you might put in wearing a blue hoodie by the train tracks, pushing shopping cart, and so if someone will see someone that's, wearing a blue hoodie, pushing a shopping cart by the train tracks, then ideally in the command center, you can say, you know what, we counted this person twice. You could also put other, we do see people using the notes field for other purposes too. And sometimes it's reaching back out to whoever's in the command center managing it to say, this person needs help, or I wasn't able to engage, or whatever. So, if you're doing an observation tally and surveying, that you might note the reason why you went this route in there too. So there's different options for that. So 4 simple demographic questions, the notes field, and then beyond that, what gets captured every time you submit a survey is the information for the volunteer, the location, and the date and time of where that happened. So that's called metadata, and that goes with every survey, is the who, when, and where kind of attributes of the survey. And this is a good option if you have a low volunteer turnout and limited street outreach. So, this is something where, something to explore for that. So if you're doing, looking to do this traditional unsheltered survey like we've done in the past, there's some safety precautions you can take. So, and we'll kind of cover those too. So ideally you're conducting virtual trainings like we're doing right now. So you get people to volunteer, you have their email address, you say, we're gonna be doing a training on this date, we're gonna record it. And if you can't make it, and then potentially you can actually do like maybe a potential quick quiz, like there's tools like Quizlet out there that you can use if you need to. But the easiest thing is to have someone submit a survey. The way that the app works is you can have it in test training mode, and someone can use the app if they can drop a survey, and you'll see that the information comes through the command center. For the point in time count, the ideal is to assign volunteers to designated areas. So they already know going into the count where they're supposed to go. Oftentimes what ends up happening is there's this blitz approach where everyone has to go to the mayor's office, for a big press event, and they get their assignment there, and then they distribute out slowly throughout the city or the county from the mayor's office or whatever the press event is, and then later on they come back and hand in their paper or whatever. Here we don't need to do that because we can designate the regions ahead of time and let people know that this is where you're supposed to go. So the map on the right is what's called a census tract, and you could break it up even further. But basically the idea is you're assigning people to a sub-region within your COC is an option for some of the larger COCs. We have that functionality. Ideally, you're having the volunteers use your own transportation. You're not going to be pairing people up and saying, "Oh, can you jump in the van, a car with this first, random stranger." If they are going to be partnered up and needing to share a car, ideally it's people in the same household, right? They're already living together anyway, so they can share the same car. And then, as far as the account administrator's perspective, you're no longer going to the mayor's office or wherever command central is. You can watch and monitor the whole count from your couch or wherever you want to hang out and watch the pinpoints drop. Really you need to have a laptop open and a phone, and your beverage of choice, maybe something in the background. I don't know. That's kind of that's what the pit becomes when you don't when you automate everything. It's no longer this giant event with, you know, chaos. So you're avoiding the centralized deployment sites altogether. And then you're also trying to do whatever you can to minimize close contact. So part of that is getting rid of paper. So no need to exchange physical objects between people. So the region team management functionality that I was discussing, so you can divide your continuum of care into regions as a step point. And these are optional features. So if you don't have a contract already, if you're interested, we can send you pricing. What we try to do, just to explain that part, is we have a base price that we try to make it this, you know, doable for everyone. And then you can add optional features on top of that. So this is an optional feature, but what you're seeing is the assignment or the breaking up of a continuum of care into regions, and then within regions, you can create count teams. And the point of it is later on, once you create those count teams and designate areas for them, then you can assign people to those count teams. And beyond that, there's a known location survey, which I'll touch on. And there's other ways to identify known, like high probability areas or certainty areas, as HUD calls them. You know, you can use that to help figure out how many people should be on a certain team to a certain area. So remote point in time count training is HUD encouraging. You know, we have instructional videos online. You can use. Volunteers can be prompted to submit a test survey. Like I said, you know, if they can submit a survey, then you know that they don't have to download the app and fill it out. And then again, you can use tools like Quizlet to make sure that they're ready to go. You know, no third-party endorsement here, but I know my kids use it all the time for getting ready for home or for upcoming tests. So they told me about it. It works pretty well. The brief survey count. This is the advantage of this, much shorter survey. The volunteers don't have to ask the tough questions. When I say tough questions, I'm talking about things like HIV status, experience with domestic violence, you know, any disabling conditions, really. The disadvantages of that is it requires integration with HMIS or outreach data, or what's going to happen when you go to run that point in time report, all the information about the, you know, the subpopulation information, you know, some chronic health, even chronic homeless status, because that requires a disabling condition. Those pieces aren't going to be part of that report. You really just can have the demographic sections of it about, you know, age breakdown, race-based breakdown, ethnicity, household composition, that level, but you're not going to get to the, you know, be able to tease out, you know, a little bit more information about what your population on the streets is looking like, and, you know, what their characteristics are. So the brief survey, again, it is brief. You're asking things like, you know, first off, have you already been surveyed? You can't do that from an observation. You know, you're literally just, and you can do that from a distance. You know, hey, did anyone contact you about the point in time count? You know, you don't have to be close to do that. And really, you know, one of the things, again, you need to validate the person's actually experiencing homelessness, so their sleeping location, so you start off there. And then from there, it's basic demographics, name, date of birth. You know, if they're not going to give you date of birth, can I get your age? If they're not going to give you age, can I get your age range? Or just I'll leave it to the person to assume age range. And the reason why that's the one required field is some form of age is that's what we use for household composition. So, you know, if it's two adults, it's not the same, treated the same as an adult and a child as far as reporting goes. So, and then optionally, race and ethnicity are not needed. They're helpful because if you don't have them, again, those parts of the report are blank. But the other option is not to ask them at all, but to get the data elsewhere. So you could do an integration with either HMIS data, if you know the person's been served before by any provider that uses HMIS, or use outreach data. And you know, we have a tool that we'll be sharing called Show the Way to support ongoing data collection using similar GPS-enabled surveys as we do for Counting Us, but ongoing basis for street outreach. Another option that HUD provides is conducting the point-in-time count over a longer period. So the big change here is it's not where did you sleep last night, it's where did you sleep on the night of whatever, Monday the 23rd or whatever. So you can do that for a period of time, 10 days, and kind of spread it out. Again, you're asking someone, did you already get surveyed? But then after they say, if they say no, then you can find out, try to find out the information about where they slept on that given night. So again, ability to do less with more. If you're going to do a hybrid for observation tallies, even if you're doing a longer count time frame, for those, you still have to focus in on that one night, unless it has that geographic kind of like lack of mobility situation I was referring to. And then beyond that, what you can also do to limit the need for volunteers is do what's called sampling and enumeration. So HUD did a webinar last week. They're talking about, some of it got really kind of brainy. We're going to try to simplify it for you. But basically what it does is it allows you to prove strategy for effective coverage, and it allows you, where a census, you're going to go out and interview everyone. A sample, as on the right shows, you're really just looking at certain people, and then what you're going to do is called extrapolate to derive, based on the information you did gather, derive estimates and identify the characteristics for the rest. So again, in the quote, sampling provide an accurate measure of the COC's homeless population if it's done correctly, including an appropriate sample size. So that was a question I asked during the webinar. And part of it was to get out to the idea that I can't sample half of my children and say, what do you want for dinner tonight? And say, well, everyone wants pizza, because that's not really fair. But if I had, if it's 1,000 people and 80% love like pizza, well, I guess we're going to get pizza, So the idea of having a decent sample size is important. This is an animated GIF, but what this is a function within the command center that allows us to look at high probability areas. And what we do is, in HUD, they call them certainty areas, like areas where someone's going to be homeless, just because you see people there all the time. Not you, but your street outreach workers, people using the known location survey that's available for free to everyone. So basically, you can be using the window between now and the point in time count to identify your certainty locations, your high probability areas. And then the other areas, what you do is you do a random sample of those low probability areas. So if 20% of your region, we know people are going to be experiencing homelessness are here, then the other 80%, we could say, you know what, we're just going to throw darts. And the computer does it for you. It's not really, but it's randomly selecting census tracts, and you just need to inform it how many tracts we're going to randomly sample, and that's based on again, the sample size is important, but it's also based on the number of volunteers you have to work with. So we're trying to find that balance, and from there it creates a map and says this is where we need to go. And we again, we have a statistician, Dan Trebley, that we work with to help support this. So it's not just, it's vetted. And this work, what we're showing here, was for the state of Connecticut. And, the important thing with the state of Connecticut in this model, and this is pre-COVID, mind you, they were able to, there's 78 high probability areas. And then they, of all the 833, they ended up just sampling just over 200 census tracts. So in essence, they were able to get by with roughly 40% coverage of the entire state and still derive estimates for the entire state. So 60% of the state they didn't even have to go to create an estimate for this. So it's something to factor in. And it was great to see that HUD is standing behind this type of methodology. So again, another point to consider. Demographic extrapolation. Here's where you're saying, we didn't capture the data for everyone. All the race, ethnicity, et cetera. There's a lot of blanks here. So in the command center, you can run the reports with that demographic extrapolation. And what they're going to do is it's going to create a report where it's an estimated count that's derived based on what the actuals are. So, and what you're looking at here is response rates. So for all the people that were surveyed, in this case, roughly 40, I'm not really sure, but of those, how many, did we get answers for? And if it's above 80%, ideally that's kind of the cutoff line, then we have enough information to go on to create estimates for the whole. And so this is really just applying a multiplier to derive an estimate. And, you know, obviously when you apply a multiplier, sometimes you get fractions, and there's no such thing as a quarter of a person, but, you know, you might have to do some rounding there. So while we're on this, good point to pause. Is there any questions come through the chat?
Yeah, we had a couple questions about customizing the brief version of the unsheltered survey or the observation tally surveys, and if that's sort of part of the customizing additional feature, or if that can just be done to tailor to local needs.
Yeah, I mean, let me just say this. So we are a mission-driven for-profit company. So there's a balance, right, with that. So we're not, you know, we have to, with a contract, you kind of have to say what you're going to do, right? And then it's expectations on both sides. But we're also not going to, if it's something that we can do pretty readily, and you need it, like, we will do what we can to accommodate. And I think those of you that have worked with us in the past, you know, for the point in time counts, know that. But I know for people that haven't had a chance to work with us, yeah, it's kind of a leap of faith. But yeah, I mean, within reason, you know, minor changes we can accommodate. And if you're not sure up front, ask up before we sign anything, just so we're all on the same page of what's agreeable and what's not. So I think it's the best way to say it. Any other questions? No, not for that. All right. So certainty sites. So this is what HUD was calling certainty sites in their sampling enumeration call. We call them high probability areas. You know, we'll start calling them certainty sites now, I guess, because HUD is the one we're hearing to their guidance. So options for available to inform your certainty sites. You can use last year's point in time count data. You know, for those of us who have worked together in the past, we have, you have access to your prior information. You can use that. You can use this known location survey, and that survey, I don't think we're showing it here, but literally it's like how many people are experiencing homelessness in this area. It's an integer, and from that we can get an idea of the density, the population density of people experiencing homelessness across the region. As long as you have people using the surveys and going out and dropping pinpoints. And they don't even have to, if they know, because they through their daily work, like through outreach, they don't have to go there to do it. They just can drop pinpoints from their laptop and say, well, I know the people here, I know the people there, et cetera. You're trying to inform the process here. Street outreach data. So again, anyone using GPS enabled tools on an ongoing basis for street outreach, like Show the Way, you can use that data to inform your known location. And then beyond that, there's something called inferential modeling. In inferential modeling, I created an excerpt from the General Accountability Office report that Senator Maxine Waters asked for to provide some oversight about the HUD point in time count. And one of the facts that was, or parts of research that were cited here, was that they had some econometric analysis, not easy to say, that showed a relationship between housing rent burden, so household median rents, and so you look at the rent, and then you look at fair market, area median income, sorry, compare those together, you can get called a housing rent burden. And basically what we're able to do is look at census data to infer the likelihood of an area containing people experiencing homelessness, is what it comes down to. So that's an idea of inferential modeling. So the idea of being able to infer, not initially going there, but think about a giant balance of state COC. You don't know the whole place, and it's going to be really hard to do that. But the idea is to have an educated guess. I hate the word guess, but it's in this case to be able to infer that there's going to be this area. We should try to send volunteers there. So what do you do once you know what areas to go to? So this is an example. Again, we can use the known location survey, and again, that's free. You can use it from now, throughout the PIT and beyond. So identify your hotspots. And what you're doing here is, in this example, it's showing on the map the population density. Now, each of those pinpoints are color coded. I don't have the key, but some are higher than others. And we can also render things differently too. We can think about doing hotspot mapping, et cetera, like kind of a heat map. But what you're trying to do here is say, like, okay, where are people that experience homelessness? Where do they tend to congregate? That's the important piece. And then, the idea is, once you know where the people are, then you can look to say, all right, this is where we really need to target the resources towards. And then, so there's that. And then beyond that, HUD, one of the pieces of guidance was to encourage the use of mobile counting applications. So awesome that HUD is behind this idea. HUD actually licensed the HUD point in time counting tool from Syntax Solutions back in, I think it was 2013. And so we worked with them for a couple of years, but because of fair housing law, they couldn't host the data. So we ended up parting ways, with HUD because of that, because it was really hard for communities to support their own command center. But we kept going with the work that we started with before we worked with HUD. And now we have Counting Us in the command center. So good news as far as how it's industry proven, and also from a research perspective, is that we have over 30% of the geography of the U.S. As of last year, and hopefully it'll be, we'll see what happens for this year, using our mobile technology, to support their point in time count. So here's an example of the app, just how it works. The surveys are customizable. Again, the base price, it has a core survey questions, have everything you need for the PIT. And then if you wanted to ask your own questions, we have the ability to work those in. So custom surveys can be done, custom questions within those surveys, custom responses. We can support Spanish speaking, whether it's the interviewer or the interviewee. Spanish surveys are now available. Currently just Spanish, and I think we have to thank Texas Balance the State for providing the translations for those, because we don't, at least I don't speak native Spanish very well. Un poco. That's all I got. And then as far as conditional logic, to be able to trigger the display of other questions based on the responses to the questions above. That way you're not asking a child if he or she is a veteran, like that kind of thing. And you can also make questions required or optional. And you can, again, you can show hide or hide questions based on the responses. So new features for those of you that have been working with us for a while, these are all new features that we have put into play. I won't go through them all just for the sake of time, but there's a lot of them. So it's nothing that we just pick up in November and say, let's get ready for the point in time count. We do it year round. The idea of being able to use other data is really important. So we have outreach data that you can use to ask the tough questions. So trained people that are, that have a rapport with people living on the streets, not some stranger that just walks up for the first time and says, hey, like, what's your name? What's your, disabling conditions, all that. Sometimes to get those tough questions answered properly, you need to have a relationship with the person. And it allows, by using street outreach data and the work of your trusted, people you trust for that job, you can build up your point in time data story over the course of the entire year. This is, for those that are interested, this is Show the Way as an example. Ongoing street outreach for that tough data collection. We support different options for how to look up information. I'll show those in a second. But again, you can either start with a clean slate, or you can integrate with HMIS data that you already have and add to that. And again, you'll see some of the things in the HUD data standards here, but also some things that aren't in the HUD data standards, like contact information, like phone number and email of the person experiencing homelessness. So you can, really work with that person virtually too. And that can be even done after the point in time count. So, because you can still paint that picture of the people that were experiencing homelessness on the night of the count. You're taking attendance basically of who was there, but you can still get more information leading up to it and even after it, because the count and the point in time report isn't due until April 30th typically. And you can use this to create a binding list of people living on the streets. And that way you know who's out there, who's working with them, what their needs are, what works well, what doesn't work well, etc. And then you work together, because even street outreach workers, they work really hard. They all need to sleep eventually. So that's so you can collaborate. And people move too. So that's the other important part of it. And as far as the client search, there's 3 options to find the client. You can search by name, just like we, typical. We actually support Amazon Web Services has facial recognition that we incorporated into our technology. So if someone isn't comfortable providing their name for whatever reason, you could also have the option, again, to take their picture, and you could identify them that way. And we can also do an ID card scan. So if you have the community ID card, for example, we could do a barcode scan off of that. Beyond that, something that's really important here in California is to know where your encampments are. We have wildfires, we're high risk, so to know where people are, but also to be able to provide services, support the CDC guidance of sheltering in place. It's important to know where those camps are. So you can observe encampments, you can take pictures of them, you can capture the information pertinent to the CDC guidelines, and then ideally you're connecting camps to people. So these are the people at this camp. So if there is a COVID outbreak, who was sleeping in that camp on that night with that same person that we know is COVID positive? That's what we want to be able to work towards. And then you can actually turn camps on or off too. That's the other important piece. So, some get swept and some, they come back. So that's another piece. The binding list in the command center, ongoing binding list of people experiencing homelessness, GPS enabled. And this is, this functionality is similar for Counting Us as is Show the Way. But for Show the Way, it's a little bit more care coordination, concepts built in. And you're building your point in time data story over time. And again, the sensitive questions are asked by outreach. This is just an example of how the GPS-enabled data has helped support the homeless response and some of the COVID precautions we have here in San Diego. We're also doing, the Lucky Duck Foundation here supporting the distribution of over 1,000 meals a day, and we have 20 outreach teams working together to do this exercise. Jen Marie was talking earlier, the key part of that through the Regional Task Force on the Homeless. And, what we need to do, the logistics of that, it's almost like, it's a monumental task if you really think about it. How are we going to coordinate these outreach teams that don't have the same funding, have different people, different coverage areas, and bring them together? And so, we're using GPS-enabled tools to support that work. And then when it comes to integration with HMIS, to be able to pull in data from HMIS. So you'll be able to use a system of record, your HMIS as a system of record to get organizations and projects, and then to be able to pull in information, about their shelter experiences. So you have one what's called longitudinal record of a person's homeless experience, and you're adding data back to that. And then ideally, depending on the system you use, we can send the HMIS data back to your system. So you can still use the front end HMIS software that you're used to for all your shelters and permanent housing. But for people living on the streets, it's people you don't carry around a desktop with you everywhere you go if you're a street outreach worker. So typically that means that those outreach teams have to go back and key in data after their job, the job they want to be doing is done. So we're trying to make it so it's all real time, actionable intelligence in front of the person right there, not pen and paper. And then this is all supported through a framework. So we have a data warehouse called homelessdata.com. So Show the Way and Counting Us and our integrated data sets go through the warehouse, but we also can lean on your HMIS. So we work around what the gaps of your HMIS. So this is an example of the hybrid approach of using Counting Us to basically take attendance of who's homeless on the night of the count, and then using Show the Way to get that more sensitive information, from the data collected over time from outreach, and then bringing those data records together to say, here's who's homeless on the night of the count, and then running a report off of that. And what I'm showing here is the code that we have using Amazon Web Glue. They have a machine learning algorithm to help tie the data together to create that one composite data story. And some resources available for you. Again, all this is on our point-in-time.info website under the resources tab, but these are some related to our conversation today, things I wanted to highlight. And that is the webinar. So now it's open up for questions. We have a few minutes, and sorry, I wanted to make sure we had some time for questions, so I kind of rushed it a little bit at the end, but I want to make sure we had time for any questions people had.
So one question that just came in is there a deadline for signing on for using Counting Us for this year's point-in-time count?
No, I mean, I use this example because it's very memorable, but I think it was the Friday of Labor Day weekend when Hurricane Harvey hit Texas, and we were able to get them up by live and going by Sunday. So I mean, that was a pretty large community. We don't want to encourage that everyone just does it the last minute, and you're going to want to have a window of time to provide training and say this is what we're doing in messaging. But from our perspective, I mean, last year we had, I'm not going to name names, we had some pretty large COCs make the late determination that they wanted to use our technology middle of January. And no one knew, put it that way, that they were a little bit late, making the decision. So yeah, you have a window. I would try to encourage getting the paper, there's some bureaucracy sometimes with making like the paperwork side of it. So, if you do want pricing or to get the ball rolling, just send an email. You can send something to myself. I'm Matt at fintechsolutions.com. Team at fintechsolutions.com goes to all of us. And for the night of the point in time, just so you know, whenever we're the period of your point in time, you can use help desk or at fintechsolutions.com or PIT at fintechsolutions.com, and that will create a ticket. So that's more for issue-related things. But yeah, you can get, and there's also a contact form on the point-in-time.info website that we, if you use that, we capture some key information. It helps us get the conversation going, get you an answer quicker about pricing, what options are available, et cetera.
Matt, there's another question in the chat. How is PII data entered in the app protected? And for how long does Simtex store the data that was entered?
Very good question. We do have a FAQ on this that I can maybe drop into because obviously security is very important. We do use Amazon Web Services for our hosting environment. All data is encrypted both during transit through SSL. So I'm getting a little technical here. So I am going to look for the FAQ just because I think it's going to answer better than I can, and it's got some details that you might want to be able to share back with people. As far as the data is concerned, we tend to leave the data available to you because it's your data, and you can send a request to have it deleted at any time. So we have a 7-year max after working with a client. If we haven't worked with you since, we will definitely get rid of the data, but it's your data to keep, and that's going to enable you to support year-over-year trend analysis. So, maybe like what happened with HUD one year is they asked about females in the demographic section, they asked about veteran status, and the next year they asked about how many female veterans you had. And unless you had the data to go back and say how many female veterans we had, you would never be able to tease that out. So we do try to keep that data so you can query it later. But I'll look for the FAQ and I'll put it in the chat. And again, if you have any direct questions, if I am not able to respond to things, please send an email to team@fintechsolutions.com, and we'll work together to get back to you. But I'm gonna look for the FAQ now. Any other questions? No. All right. Well, I need a second to find the FAQ. I will put it in the chat.
Oh, don't worry about that, Matt. I just popped that in there.
Oh, you did. Oh, thank you, Kevin. See, this is you're getting to meet members of the team, by the way. Everyone's jumping in. So Kevin's one of the lead developers here at SimTech. Nikki and Becky are both community impact advisors here at SimTech. You know, Becky's actually been using our tech on the other side, you know, being a user and an administrator. So she knows firsthand some of the, you know, struggles of the paper-based count and the virtues of going digital. You know, I'm not sure Nathan might also be on, but yeah. So just so you know that it's not, you know, me working in my garage, you know, by myself and come up with those ideas. I owe a lot to the team here. We wouldn't be where we are without them and their dedication to the work, but also their brilliance. You know, I like making them blush. And yeah, I'm really lucky to have this team behind us. So you get them if you work with us. So you get to work with them too. But yeah, and we also have you know, just to say, we have a large group of clients, and we try to support this idea with the community, that, you know, we're not all doing this, you know, in isolation. And so if people have ideas of how to make our tech better, if they have ideas of what to share with other communities, if there's this future webinar idea, like, you know, hey, really helpful if you talked about this, you know, we're all ears. You know, I've been doing the point in time counts again since 2003. I was on your side too, you know, but, you know, happen to have some ability to create with technology. And so hoping that, you know, we're addressing some pain points. This is not going to be a normal year either. So not everyone's answer is going to be the right for, you know, the next community over. So we'll work through the, you know, the process with you to help figure out what makes sense. So everyone gets an hour of training, you know, minimum. You know, we say that in the contract, and again, we have to limit kind of exposure to kind of prevent what's called scope creep. But, you know, again, we're not going to say, oh, it's an hour and 15 minutes, you're up, you know, or whatever. You know, we want you to understand, you know, this to work for you. So you don't have to be a client to ask questions. Just say that. So, but again, I really appreciate all of your work, time and dedication to this. The people that are experiencing homelessness need you now more than ever. So thank you for the work that you're doing. And if we can help support you in any way, count us in. With that, I think it's a wrap. All right. Everyone have a good day.